Good morning. At the onset, I would like to thank Team Cipla for organizing this patient awareness campaign. Dear friends, today's our topic of discussion is understanding hypertension. Our today's discussion will be on what blood pressure is and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, the blood pumps into the blood vessels and it creates a pressure on the wall of the blood vessels, and this is known as blood pressure. Normally, in a healthy person, it rises and falls throughout the day, but when it remains high for a longer period, it is known as hypertension, and it can lead to serious health problems like stroke, heart attack, kidney failure, blindness, etc. High blood pressure usually develops over a period of time. It can happen because of unhealthy lifestyle choices like not having regular exercise, obesity, smoking, high alcohol intake, stress, like things. There are other risk factors that can also increase the risk of developing hypertension, like age. We know as the age increases or we get older, our arteries stiffen up and builds fat, which leads to narrowing of the arteries and increasing blood pressure. History of family members having hypertension. If our close relative like our father, mother or uncle, they are having a history of blood pressure, it passes from one generation to another. Excess salt intake in food is also known to raise blood pressure. Not eating enough food containing potassium can also increase blood pressure. Eating processed and fat containing foods increases blood pressure. And another most important factor in day-to-day life is stress. Stress can lead to unhealthy ways of leading life and ultimately leads to increasing blood pressure. So moving on, hypertension does not have any obvious signs and symptoms. That's why it is often known as silent killer. It puts people at risk for several diseases, from cardiovascular to renal to stroke and even eye problems, which may lead to blindness. Generally, when symptoms do occur, they include morning headache, tiredness, vision changes, buzzing in ear, fatigue, nausea or vomiting. If a person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try to understand what does these numbers actually mean. A healthy or normal blood pressure should be less than or equal to 120/80. Here the upper number indicates systolic blood pressure and the lower number indicates diastolic blood pressure. The diastolic blood pressure is the pressure which when the heart is at rest, and systolic blood pressure is the pressure when heart pumps the blood. This risk can be managed by taking few steps of healthy lifestyles like doing regular exercise, healthy diet, quitting smoking and reducing alcohol intake, regular blood pressure monitoring, stress management and adherence to medicines. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay or reduce the need for medications. So let's take a look at these strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach to lowering blood pressure. Regular physical activity makes person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on the blood pressure will decrease and lower the blood pressure. In another case, as we all are aware that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level, that is less than 120/80, then exercise can help prevent it from rising as the age increases. Regular exercise also helps you to maintain a healthy weight, which may be a better way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High blood pressure can reduce by doing regular structured exercise such as brisk walking, jogging and swimming, etc. Healthy diet. Diet also plays an important role in controlling blood pressure. A diet with high intake of vegetables, fruits and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension, though dietary intervention, one can adopt a dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat-free diet, getting plenty of potassium through diet, limiting the amount of sodium in diet and also limiting alcohol consumptions. DASH stands for dietary approach to avoid or stop hypertension diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables and low fat products and skims on saturation fat cholesterol can lower one's blood pressure by up to 11 mm of Hg. If a patient is having a high pressure, try to reduce sodium in your diet. Even a small reduction in sodium can reduce your blood pressure by 5 to 6 mm. So how can you actually reduce sodium in your diet? You can follow simple steps like read the labels in processed food. If possible, choose low sodium alternatives of these foods and beverages. Eat few processed food. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. So if you eat natural products, you actually get rid of this added salt. Don't add salt. Just 1 tablespoon of salt have 2300 milligram of sodium. So try to avoid extra salt to your foods. Use herbs and spices to add flavor in your food if you like. Quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart diseases and improve your overall health. Regular blood pressure monitoring is the key in controlling your blood pressure and also timely diagnosis of high blood pressure. So moving to the next topic, that is stress management. So moving to this topic, stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques includes exercising, listening to music, focusing on something calm and peaceful, and meditation. Moving to our last topic, that is adherence to medicine. A medicine to lower blood pressure may be recommended by your doctor if your blood pressure is consistently high, usually at or above 140/90. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be preventive as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular diseases and complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.